get us ready to start talking about healthcare financing and payment, we need a little bit of a baseline in the economics of healthcare. So I'm going to talk about just a few fundamental elements of how healthcare markets work and don't work, and in particular, the notion of market failure. We'll also talk about the important role of physicians as agents for patients. And we couldn't really talk about healthcare without bringing in the role of insurance, its importance, and the way it distorts decisions that patients and physicians make. And finally, we're going to end with where prices come from in healthcare and what kinds of patterns we see as a result of the way they're set. So the classic economic model of a market equilibrium has this idea that there's an independent demand function, so consumers are out there deciding what they want to buy, how much they're willing to pay for it, and a supply function. Those are the producers. In this market, that would be healthcare providers. In these economic models, then, prices and the quantity of a good that is ultimately sold are set by the intersection of supply and demand. So in my simple graph here, you'll see there's some level of quantity that's produced at an equilibrium price that clears the market. That is, everyone who wants to buy at that price gets the good. That notion of market equilibrium doesn't really work for healthcare for a variety of reasons. First and foremost, the idea that patients have some independent demand for healthcare without consulting a physician first doesn't meet any of our expectations about how healthcare really is delivered. So this brings us to physician agency. Patients rely on physicians not only to tell them what kind of treatment they need, but also to tell them whether they have a problem that can be solved with healthcare in the first place. So typically, patients rely not only on their physician for telling them which pills to take, but also whether they should go see a specialist, whether they need to go to the hospital. And as a result of the fact that physicians play this crucial role, they can't simply be sellers as in any other market, as in the car sales market, for example. You really need to trust your physician. If you didn't trust your physician, he or she could be selling you something you really don't need, something that's harmful. And so there are these non-market institutions, as economists would think about them, such as trust, such as professionalism and professional relationships that will determine how this market functions. What are the prices and quantities ultimately? So we don't expect physicians to be out there advertising their services, competing by lowering their prices as we see for other kinds of goods. And that, again, is going to lead to a different kind of market circumstance than we see for other goods and services. Next, we have to consider the important role of health insurance. So naturally, healthcare these days is quite expensive, and in the cases of something major, many people can't afford to pay out of pocket for healthcare. So that's one way in which insurance is beneficial. It allows us to pool these risks of very large payments across the population so people can get access to care. It also allows individuals to essentially insure themselves over time, to anticipate these large costs. So that's the benefit of insurance. The result is, however, that insurers pay for healthcare rather than individuals, and so most patients don't see the full price of any service that they choose or that their doctor recommends. That means they will be just as happy to get a very high-cost test as a very low-cost test because they're not really paying the difference. Physicians, likewise, they don't pay the difference between a high-cost intervention and so-called watchful waiting, and so they may be relatively insensitive to prices. This over time has evolved into a situation where we observe that there's relatively high demand for services that may have relatively low value and high cost. So insurance is going to affect the way prices get set in the circumstance as well. If a patient fully insured could consume any service they wanted at any price the providers wish to set it at, then we'd see very high prices. As a result, we don't see standard market pricing. That is, physicians don't get to charge whatever they want to insured patients. And so, in fact, what we see here is very wide variation in pricing, and these wide variations almost surely in part reflect missing information for the value of specific services, imperfect information also about the quality of specific services. So in this chart, we show you variation in payments to different providers by one California insurer for the same service. So in the yellow bars, we have appendectomy. In the red bars, we have coronary artery bypass graft surgery. And you can see there is very wide variation in pricing for these services. And it may be that the more expensive services are being delivered by hospitals that have a very strong reputation, like an academic medical center. But even when we look within type of hospital, with all the information available we have about differences between hospitals, we see very wide price dispersion. This price dispersion suggests that there is a market failure here. So not only, again, are prices typically negotiated and set by insurers, but they are set with information on factors that may go beyond the quality of the service. It may, for example, reflect in part the market power, the ability to demand high prices for these providers. So this piece of market failure, as it is demonstrated through price variability, is typical of the healthcare system in the US, and we see it for all goods and services. So prices, as I mentioned before, are typically set by insurers or public payers in negotiation with providers. In some cases, those payers have the ability to set prices without negotiation. And instead of, for example, looking specifically at the quality of the services and trying to set a quasi-market price, what payers mostly do is try to reimburse fairly for the cost of delivering those services so that patients get access. And so here, this algorithm shown in the chart is just an example of how a payment system works and builds up from the cost of delivering service, labor and non-labor costs of those services, adjusting for factors that may have to do with the type of provider as well as the geographic area. This is essentially the way Medicare pays for hospital stays. It builds up those prices off of costs. And that is a very typical reimbursement system in the US healthcare system. Many private payers rely on Medicare in effect to set prices, and they follow Medicare. Of course, the way Medicare sets those prices, the extent to which it is reimbursing in a fair and equitable manner across services, will determine the incentives to providers to deliver services. The short of it is that where Medicare pays generously, providers are more likely to deliver those services. So Medicare can raise or lower payments for a service in order to get more or less of that, to improve quality, to reduce cost. It will clearly affect the access to care, exactly how those prices are set. So this will keep coming back as we start talking about healthcare quality and the use of payment incentives to affect those kinds of market outcomes in healthcare. So just to summarize, healthcare markets, while health economics is a useful tool, healthcare markets don't work like other markets. There are market failures having to do with the information that patients and others have about the quality of care, about what patients really need in a particular case. Doctor-patient relationships are going to play a central role in how markets clear in healthcare. Doctors are trusted advisors and do not typically compete in the way that other firms do. Prices, therefore, don't come from this market interaction between a demand curve and a supply curve, but they're set administratively by payers, including Medicare and Medicaid in the US. And the way those payers choose to set prices, both the levels and the specific formulas, will affect the quality and cost of care.